My name is Wan Afrina, binti Wan Mohd Nazam, and my metric number is 1210465. And today I would like to share about health communication theory. Health communication is an area of study that examines how the use different communication strategies can keep people informed about their health and influence their behavior so they can live healthier life. It draws from many theories and disciplines, including social, cognitive, and communication theories, marketing, and public relations. Public health experts recognize health communication as vital to public health programs that address disease prevention, health promotion, and quality of life. It can make important contribution to promote and improve the health of individuals, communities, and societies. Author of Health Communication Theory is Teresa L. Thompson. Is a professor emerita of communication at the University of Dayton, DU. She has been the editor of the journal Health Communication for more than 30 years and has edited the Routledge Handbook of Health Communication and Encyclopedia of Health Communication. Generally, there are four approaches to health communication. First, informative. Second, educating. Third, persuasive. And the last is prompting. Evaluation. Evaluation is an essential part of any health communication effort. It is the only way that we can determine whether or not our messaging and intervention are effective. There are three types of evaluation that should be included in every health communication campaign. First, outcome evaluation. Second, formative evaluation. And the third is process evaluation. The outcome evaluation. Outcome evaluation is a measure of the effectiveness of your health communication intervention or your target population. If you are not achieving your outcomes, then you may need to consider revising your health communication campaign effort. Secondly, formative evaluation. This type of evaluation includes a metric to count your program or health campaign's activities. Process evaluation helps to describe the output of your effort, what was done and how much was done. Thirdly, process evaluation. When working with diverse population, formative evaluation is essential to ensuring that your message will resonate with a particular audience. Conduct formative evaluation before and during your health campaign or message development. So, where we use health communication theory today, doctor's office might give out pamphlets about colon cancer, or dentist office might play videos about proper dental hygiene. The for Disease Control and Prevention campaign featuring real people story of living with smoking and related disease prompt many people to quiet smoking. Public health officials holding public meetings, non-profit organization hosting forums, or government agency giving press conference. It comes in the form of different media. For example, articles, video, pamphlets, and education events, and is delivered on various platforms such as social media, radio, websites, and television.
There's so much that you can do to protect yourself and your loved ones from COVID-19. It first starts with vaccination. It's not just important that you have been vaccinated, but when was your last vaccination dose? When were you last boosted? It's really, really critical that people who are at a higher risk for severe disease, people over the age of 60, people who are immunocompromised, and our frontline workers who are most exposed to this virus receive the proper number of doses. So check your local guidelines, get vaccinated, get boosted. So vaccines are important for protecting against severe disease and death, but there's a lot that you can also do to prevent yourself from getting infected. Wearing of a mask when you're around other people and you're indoors, making sure that you open the windows and you improve ventilation when you spend time indoors, making sure that you distance as much as possible while you are still living your life, and making sure you do self-testing if you have access to those tests. There's a lot of different things that you can do every day while you live your life to live it as safely as possible, and know what your risk is and the risk of your loved ones, and take measures to lower your risk.
Theory had their advantage and the disadvantage. The advantage of health communication theory is first, health education focus on educating audience on health topics such as HIV transmission or suicide prevention. It combines different learning experience that inform people about health issues so they can take action. Health education can take place in a variety of environments. School may incorporate a suicide awareness campaign that includes a curriculum involving speakers telling personal story, as well as lessons about depression, warning signs, and resources for help. The information help brings awareness to the audience, preparing people to make healthy choices. Next, health communication theory also can build trust with the community and make announcement yearly. Is challenges of health communication theory. First, outdated or antiquated technology. Pagers, fax, radio, and telephones have their place, but they don't provide quiet, effective information to large groups. These tools work as one-to-one communication, requiring manual replication to escalate the information to involved parties. You have to call everyone on the phone list to tell them what's happening. Secondly, lack of incident response to dangerous situations like impending natural disaster, bomb threats, active shooters, and more. You are required to have evacuation plans in case of natural disaster, bomb threats, and active shooters. But do you or your employees know what the plan is? How will you notify them when the things are all clear? Not knowing how to deliver information in this extremely dangerous situation can cause injuries or a loss of life. Third, challenges to delivering the right information to the right people at the right time. When there is a change in policy or an escalated situation that needs attention quietly, printed notices are not the best way to relay details. Healthcare employees work varying shifts and alternating hours, so engaging them on a regular basis is difficult. Even if you provide lockers on-site mailbox with a static means of sharing printed information, that doesn't guarantee it was received or read by the recipient. There is a high probability of employees saying they never saw the information with the flyer system, which could cause liability issues. Having the ability to report on who received or did not receive an alert can help you take the right after action step to save time and resources. The last challenge is inability to fill shift in a timely manner. Patients never stop needing medical supervision when they are in a hospital. If you are left short-handed, you will need to quietly fill the shift. Making manual calls to all two off-duty employees is an effective, slow process. Further, there are often multiple people working to fill shift, calling a list of people. Some may be called then once while others are not called at all. Or the shift may be filled but slow communication means calls continue until word of the filled shift is received, which wastes manpower and time. As for the conclusion, effective communication helps people learn protective measures to limit exposure to disease. But myths such as hair dryer being able to kill the coronavirus and allow administration to advise healthcare workers about their rights, roles, and responsibilities. However, public health does not rely on effective communication only during emergency. Health communication can also promote behaviors and choices that can positively impact people's general well-being and everyday life. No, no matter how important the message, without expert communicators in public health, it may not reach the individuals and communities who need it. Developing a clear understanding of what health communication is can help public health professionals looking to promote healthy behavior on a local or global scale.